Black women are more likely to die from breast cancer compared to white women, although white women are more likely to get breast cancer. So there's clearly a difference there in terms of a group that actually gets the disease more, but African American women are more likely to die from it.
Breast cancer is just one example of the ongoing health inequity between black and white communities. In Durham, North Carolina, like many parts of the United States, healthcare has been built along racial lines. Built in 1895, Watts Hospital became the first centralized medical facility in Durham, providing medical care to white patients by white medical staff only. Persuaded by the African American community, a separate hospital was built in Hayti in 1901, where blacks could be seen as patients and be medical providers. The medical technology and resources available at the two hospitals was separate and unequal, resulting in the drastic health inequity between the white and black communities in Durham. In 1976, Durham County General Hospital, now Duke Regional, was opened to provide equal, integrated facilities for African American and white patients and medical staff. Despite technically integrated and equal health care today, health outcomes remain segregated along racial lines.
People of color, and particularly blacks compared to whites, still tend to fare worse in terms of their overall experiences. And some of that is related still to their experience within the healthcare system. Some of it is related to all other kinds of factors that could be social, cultural, economic, and political.
There's something unfair and unjust about lived social experience of marginalized identity categories or identity groups in the U.S. Unfair in that there's differential access to primary resources of opportunity. Unjust in the fact that even if you gain access to those resources, they may not reliably translate into outcomes the way that the broader society says that they should.
Today in Durham, health inequity remains a problem.
It's not just enough to look at the level of education that someone has, the kind of job that they have, how much money they make, or even whether they have health insurance and are regularly visiting their physician. We have to examine the pathways or the lived social experience that marginalized individuals and groups have to engage and attempt to negotiate to gain access to those resources.
I actually came here to the United States as an undocumented immigrant from England. For about 5 years, my mother and I kind of lived under the table, kind of just trying to make ends meet. I can't remember her ever having less than 3 jobs at any time growing up. But I saw this struggle, and then I also at the same time saw on television, in the news as a young teenager, messages that were saying that, you know, if you're poor it's because you're not working hard enough, or if you're poor it's because you don't want anything better. And it glared in the face of what I saw my mom doing every day while I went to school and came home and she wasn't home because she was working to make ends meet. And so my mom's health, as a result of that, she's had 2 heart attacks, she has some significant health issues.
It's not for lack of motivation, it's not for lack of willingness to work hard in the effort to be successful. The real culprit is this fundamentally unfair and unjust society that we have constructed.
For example, the level of education you have can impact your socioeconomic status, your poverty, etc., which in turn will impact your access to certain health care, healthy foods, where you live. So they all kind of are intertwined and intermingled in a very complex way.
Populations of color, particularly Black Americans, some Latino subgroups, and Native Americans are disproportionately located at the low end of the socioeconomic distribution.
In Durham, 23,000 African Americans are living in poverty, which is double that of the white population.
And I certainly believe that there are pieces related to privilege, being disenfranchised as a population, as a community, and also the bias that can happen most certainly within the healthcare system.
The impact of poverty on health extends beyond being able to physically access healthcare.
Even if you're not, quote unquote, formally impoverished or in poverty, you're only one health crisis away from being relegated to that position. And so there is a financial insecurity associated with that above and beyond just low-paying jobs.
Poverty, as it relates to place, is also a contributing factor to health inequity.
Living in chronic, if not poverty, close to poverty, has a negative impact on your health simply because of awareness of how vulnerable you are.
Durham County is undergoing significant economic changes. particularly with a wealthy white movement into downtown Durham. As a result, many historically black neighborhoods are experiencing gentrification.
In Durham County, most certainly, that when you have people who are poor, who are shifting out, moving out because they can't afford the high property taxes that comes with gentrification, and so they have to either sell their home and move or they leave, etc., that yeah, that's going to have an impact on all the other factors in their lives, including their health.
You make trade-offs at the low end of the socioeconomic distribution in terms of which of your most basic needs are going to be met.
Going to the doctor going to be your priority when you're trying to figure out how we're going to put the money together to simply pay our property taxes to keep our house and stay in this neighborhood.
So folks are forced to literally make decisions about whether they're going to pay for their medical treatment, their medication, or put food on the table, or have decent clothes for their kids to go to school with.
As a result of poverty, lack of privilege and place, health cannot be a priority for a significant portion of the African American population. In North Carolina, African Americans are 20% more likely to die of heart disease and cancer, 2.4 times as likely to die from diabetes. Infant mortality is 2.4 times higher, and over 10 times as likely to die from a communicable disease like HIV than whites. Health inequity will persist, and the large portion of our population will continue to suffer from preventable and treatable illnesses as long as institutionalized racism continues to dominate our society.
We have got to get to a point where we realize that we are all stakeholders in this effort and we all contribute to it in all kinds of ways.